notes that will be important.
Okay.
Okay.
Righty. We want to welcome everybody. I think we have one more person I'm going to admit here, and then I think we have everybody that's registered. So Dr. Hobbs, I'll let you start us off, okay?
All right. If any of you participated last year, you'll kind of recognize the flow of today's webinar. For about the first 20, 25, 30 minutes, we're talking about just generally the analysis and the reports that we produced this year under the community-based aid process. And then towards the end of it, we'll have an opportunity to go into individual breakout rooms and we'll talk about your specific report that you got. So before I get too far along, I think I'll go ahead and introduce my team. I'm Dr. Ann Hobbs, and I will bump it to Michelle.
Perfect, thanks. I'm Michelle Luters. I am the project specialist with the Evidence-Based Nebraska project here, and I will pass it off to Michaela.
Hi, I'm Michaela. I was the research specialist with JJI for making these reports. I just recently moved to another position, a grants program manager within the University of Nebraska at Omaha. So still closely related to the JJI and obviously connect and partner on some things still, but I am no longer officially on this project. I'll pass it to Emily.
Hi, my name is Emily Rader. I was brought on to help with some reporting and analysis, and happy to be here. So I will pass it over to Bennett.
Hello, I'm Bennett. I'm interning here and I'm just observing and checking it out. But yeah, very happy to be here as well.
All right. As you can see, it takes a whole team of people to do this process. So just a little bit about this year's process. We are looking at a time frame that is similar to last year's, but it picks up on 3 fiscal years from July 1, 2020 through June 30th, 2023. So this could include, I think most of you were funded continuously through it, but it could include years that you're not funded, and you'll see that in our trend analysis if you had a year that wasn't funded. Our task is that we are provided the data from the Nebraska Crime Commission. We run the analysis and then we write up these brief reports and the brief findings. One thing you'll see that's different than last year is there's more statistical analysis this year, hopefully to make these reports more meaningful and have places where you can specifically dive in and make changes to whatever process you're using. Something that's similar from last year is we are under statute, but also just in our practice, we're always trying to make programs more effective. And so we do tend to meet in communities of practice. So we're meeting with referral programs that do referrals today. And the goal, sorry, your pictures are over my screen. Um, our goal is that we produce reports that give you useful information. So at the end, you'll have an opportunity to take a survey and you can tell us if you feel like things were useful or were not. And we, like I mentioned at the beginning, we'll meet one-on-one with you to make sure we can go through your report. So that's our why really is to help any evaluation that JGI does. We try to have it be a real pathway so that it's informative for the work that you do and you can see is your vision taking place out in the field. It's not just our vision, but it's also because under the statute, under Nebraska law, JGI is named as the evaluator, and we look at whether or not programs are effective, and that means whether or not youth that are served in those programs under the statute, it looks at whether or not they have some kind of future system involvement. And we'll get into that more in depth as we go through these reports. The reports are always designed to be useful to you. You can give us feedback if you don't feel like they are. But it's really so you have a tool, you could bring it to a county board meeting, you could bring it to a funder, or you could just use it with your staff to help examine ways that you could improve your service or intervention. So we try to really in conjunction with the Crime Commission, we have various points that we look at, and then we make specific recommendations that are specific to your agency. So any of the comments at the end, actually the entire report is very specific to your agency. So to do this, we obviously need data, not just like to evaluate whether a program is effective. We have to look at specific aims of that program type. So for referral programs, it's whether or not you do refer youth out and whether or not that youth engages in that service you refer to. So we look at the data that's put in each case or for each youth, but also you have to have sufficient enough cases. So let's say you're a rural program and you only serve 3 kids a year. That's going to be pretty hard for us to say anything that's significant because it's just too few cases. So we have to have enough cases, but also enough data in those cases. There are some measures that are uniform across all program types. As I mentioned, this is something that was written into Nebraska statute. And it's because the intent of these funds was really to front load services in the communities and to prevent kids from getting deeper into the system. So that is exactly how we look at future system involvement, or some people might call it recidivism. We call it future system involvement because some of the kids that get referred out, or kids that are coming in on diversion, they may never have had a law violation yet. So we're hoping to prevent anything from happening in the future. So we look at, for future system involvement, we look at status offenses. So that's going to be like truancy or sometimes ungovernable or running away, those kind of things. Law violations are your typical shoplifting, assault, minor assaults, those kind of offenses. But for status offenses and law violations, we look at 1 year after they've completed or discharged from your program. For probation and detention, we look at any point in the future after they've done your program, did the youth get placed on probation, or did they have an intake to detention? So it's a longer time frame for those. Thanks a lot. So I will turn it over to Michaela now to talk about reading your individual report.
Yeah, thank you. So for the individual reports, very similar layouts to last year's with a few new additional charts, graphs, and so forth, but similar formats and so forth. So on the first page, you're going to see mostly the demographics for your reports or for your program. So the youth that you served over that 3 fiscal year time frame that Anne described. So on the top, you're going to see the breakdown of the number of referrals that you received to this community-based aid funded program during that 3-year period, as well as how many of those referrals were ultimately enrolled and participated in the program or received the services in which they were referred to the program for. And then there's a breakdown of this by race and ethnicity. So you might not see that graph on the right exactly how it is here. For programs in which all of the youth referred to it were enrolled or participated, however that's defined for your program. It might just be a distribution of race and ethnicity comparison rather than looking at that breakdown of referrals to enrollment for each group. But the main reason for that plot remains the same, of looking at if there's any kind of differences in how youth are being referred to the program and then enrolled by race and ethnicity. Then later on the page, you have age, gender, demographics. And then we have this new plot this year called a proportions plot that is conducting those comparisons to your community and your county populations for the youth population to your program population. So on the left side of this chart is the county population, specifically youth. And then on the right is your program's population for that entire 3-year period. So what you're looking for is comparative enrollments or referrals compared to the county, where those lines going across the plot are fairly level. When, like in this example, they kind of cave in or cave outwards, that's indicating a group that was maybe not representative in your program as they are in their count in the overall county. So in this example, while white youth make up 71% of the county, only about a third of the youth referred to the program were white, while 27% were Black and 33% were either of another race or multiple races, compared to a lot smaller percentages for the overall population in the county. And so this might just indicate One, it might indicate that youth are coming from a subpopulation in the county that is not reflective. As I know, a lot of assessment and referral programs receive referrals from the courts or diversion. That can explain some of this. But if you don't have an immediate explanation for that, that might be an area where you want to look into. Are a group of youth in the community not being reflected in your program referrals, or are some of them being overrepresented for some reason? So then moving on to the next page, this is where we have some new graphs this year. Because we have 3 years, we're able to look at trends over time, starting to look at trends. With 3 years, you're still a little limited on whether or not these are actual trends or some flukes due to the time period, especially recognizing that this is in the midst of the COVID-19 and getting used to that. But this first graph is showing the referrals that your program received, the number of youth coming into the program, that's the black line, and then looking at how many were then receiving those services, how many were referred out to services through the referral service program. And then these kind of gaps of lines, yeah, staggered line areas are representing where the JCMS data is a little not clear, I guess, where there's some indication that the youth did receive a referral, but that referral information was not filled in, or we aren't clear on what services were referred and so forth. And so that's indicating where it looks like most of the youth did receive a referral out to services, but we aren't entirely clear on that. And so it's a little bit missing and unspecified. Next, you'll see at the bottom of that page another plot that looks fairly similar to start with, but this is looking at a breakdown of race and ethnicity again. So the very bottom line is going to mimic the chart we just went over, where it's all of the youth referred to your program and showing those referrals over time, those 3-year periods. And then each line above that is going by a specific race or ethnicity group. And so what you're looking for there is you want each of those to fairly mimic the total referrals line. If we were seeing, well, this one is a pretty good example of all of the groups mimicking the referral line. What we don't want to see, or what might need to be looked into, is if one particular group maybe skyrocketed in referrals for a certain time frame where none of the other referrals increased, or when they declined or got no referrals during a period that there were referrals for others. And so, for example, if we saw that the Hispanic group of youth referred didn't increase in that last fiscal year, that would be a point that we might want to look into because all other groups did increase. And before moving on, one last thing you'll see on this page that we don't have in the slides is just a table looking at your specific outcomes for those referrals to services for the youth, split by the fiscal year. And so you're looking at the number of referrals out to services. This could be duplicated per some youth. It's not indicating the number of youth, but instead the number of referrals. So if one youth received 2 referrals out to services, they would be counted twice in that number. And then looking at the outcomes. So did the youth successfully attend that service? Are they still waiting for services? Did they not attend? Or is that outcome missing? So then the final page is getting into the outcomes for the referral services. First, we're looking at what services were referred to during that time frame. And this might have some missing data. This was one of the areas that was a little limited in what we could examine. But we wanted to give a general picture of what were the youth coming into your program needing and what did you get them access to. And then looking at an overall case outcome. So for those that were referred out, how many attended or were waiting for services, indicating that they would follow through. And then how many did not attend those services or didn't receive a referral out to services overall. Next to that, we have a breakdown of these outcomes: successful, unsuccessful, other, or referral info is missing, split up by race and ethnicity. And so you can again start to look at whether there's any discrepancies for specific groups coming into your program, or if it's relatively consistent over all of those groups. One thing to note with those graphs is when you have a really small case number for a certain group, say Hispanic youth, you actually only received one referral over the 3 years, while you, or in this example, only 4 youth were Hispanic. While we can kind of compare that to the other groups, 4 youth is not a great number of cases to really make conclusions on. And so definitely take that with a grain of salt, and don't necessarily take that as definitive that all of the time half of the Hispanic youth are going to not receive a referral. It might have been just something to do with those specific cases and not reflective of the processes in your program. All right. And then the last thing on this page is going to be that future system involvement that Dr. Hobbs explained. We've broken it down by all of the program youth who were engaged or enrolled in your program. So we did not count youth in this that did not actually participate. We only wanted to look at system involvement among those that actually participated. And then, like Anne described, we've got those 4 different types of system involvement, but we've also this year created an aggregated system involvement number that tells you your unduplicated number of youth that became system involved in any way following discharge from the program. So in italics, you'll see that under each category. So for all program youth, they had 28 or 14% of the 200 youth served had any system involvement after discharge. And then we've broken that down, comparing successful discharged cases to all other cases that can include unsuccessful, other discharges, or those that didn't participate to begin with. And we're comparing that system involvement between those groups. And this year we've done statistical tests when available. So in this example, only 7 youth were unsuccessful other or did not participate cases. And so that's usually too small of a number to really run statistical tests. It can vary. In this case, it looks like we were able to run the test because of the footnote that's included at the bottom. But in most opportunities, when it's that small of a number of cases, we won't run that statistical test. But as you can see by the footnote, the chi-square test is just looking at the statistical significance of whether or not successful youth had significantly less or were significantly less likely to have system involvement or become system involved compared to all of those other discharged cases. And so when we have that p-value less than 0.05, you'll see at the end of the footnote, that is our limit or a level to indicate significance. And we describe that a little bit more later in the evaluation summary. Then the next statistical test we were running was looking at days to system involvement. So for those cases where the youth did become system involved after leaving your program, we wanted to see whether successful youth were at least able to make it further or a longer time period after discharging to become system involved. And so this chart that you see is called a survival curve, and the percentages are actually showing the amount of youth remaining without system involvement. And so you can see as the days increase post-discharge, that line declines because that's indicating more youth becoming system involved as we get further after the program has ended. And then we ran an independent samples t-test to test the significant differences between successful and unsuccessful cases for that days to system involvement variable. So next, we've described a lot of the processes and the demographics were on the first page, and we find all that information very important to share with you, especially since you're tracking that data in JCMS, you want to get it back out and aggregate it. But I do want to note that a difference from last year is this year, the evaluation criteria, the determination of effectiveness is solely based on outcome variables. So only looking at those referral outcomes, whether youth attended the services or waiting for the services or not. And then those two future system involvement variables, comparing successful to other discharge cases and overall system involvement for youth that participated in the program. And so that next page, you'll see what we are calling the evaluation matrix for this year. And it has 3 categories I just described for referral programs. As you can see, in some cases, one of the categories will be grayed out. This usually means that either there was too much missing data for that category to be evaluated, Or like I was describing earlier, there were too few cases. So when unsuccessful or other discharge cases were less than 10, we typically did not run the statistical test and so couldn't evaluate that category. What we've done to make sure this doesn't harm or hurt the evaluation rating, though, is you'll see at the bottom it describes these scores as percentages of total possible points. So when a category is removed like this, it reduces the number of total possible points for the evaluation. And so instead of 15 possible points for overall referral programs, this reduced it to 10 possible points. And the program's total score would be a 5 out of 10 or a 50%, which is in that promising rating. Below that matrix, you'll see this kind of sliding scale that just visualizes that final score. So in this case, the program received 5 out of 15 points, giving it a promising score, which was 33%. And then on the very last page, we've got that summary narrating again what those graphs were really showing you, what the data told us, and those outcomes of the statistical tests that we run, leading into the recommendations based on those evaluation categories. Where are some areas we noted might need improvement? Where are some areas doing well that could be built upon and continue to strengthen the program, or other areas of concern or note?
Awesome. Thanks, Michaela. If you have questions on your specific report, you'll be able to ask those in just a minute. But if you have other programs that you oversee, this is a list, and you should have gotten an email that so you can set aside these times coming up. We've already we're on our third row here, so we've already done ATDs, assessments, and then now we're on referrals. So if you have any of these programs coming up, family support, mental health, mediation, be aware of those. They're scheduled to be coming up on our schedule. So before we go to individual breakout rooms, does anybody have questions just in general about why did we take this approach, and just general questions about the reports this year? And I might need somebody out there. Like I say, you can raise your hand or whatever works for you. If not, tell me if I miss anyone. At this point, what we will do, and Michelle will help me, we'll go into individual breakout rooms. So if there's somebody that you want to be partnered with, make sure you unmute and tell us. Otherwise, we group you by county or by group, your program. And while you're waiting to go, if there's more people, then we'll only have 2 rooms. So if there's more than 2 groups, if you could, please take the survey. Michelle, are you able to put that into the chat box?
Yep, I just pushed it into the chat box so people can click on that link and complete the survey for us.
So we really do welcome feedback. These have changed from last year, but I think they're designed really to have more statistical significance. And so we hope they're helpful. Boy, it must be the afternoon. But so we really would love your feedback, and you can be as straightforward as you'd like. But if there aren't any other general questions, I will trust that Michelle will put us into breakout rooms. There'll be one of us that's kind of going through your report, and then another staff will be taking some notes as we go. So, are we ready for breakout rooms? All right. I think the recording will stop when